Explore the evolution of spinal injury management in EMS, and learn how selective spinal immobilization and spinal motion restriction enhance patient care. Spinal motion restriction, or SMR, refers to the process of minimizing unnecessary movement of the spine when a spinal injury is suspected. Unlike traditional spinal immobilization, SMR does not require routine use of rigid devices like backboards. Instead, SMR uses clinically guided techniques such as cervical collars, patient positioning, and securing patients to stretchers to safely protect the spine. Traditional spinal immobilization relied heavily on rigid devices like backboards and head blocks. While effective in preventing movement, these methods often caused complications including increased pain and discomfort, respiratory difficulties, and pressure ulcers from prolonged backboard use. In contrast, SMR focuses on patient comfort while still minimizing spinal movement. This involves selective use of cervical collars, positioning patients supine or semi-fowlers on a stretcher, and securing them snugly with stretcher straps. By reducing unnecessary immobilization, SMR ensures better patient outcomes and higher provider efficiency. The benefits of spinal motion restriction include enhanced comfort. Patients experience less pain and distress without prolonged backboard use. Improved safety, reduced risks of pressure sores and respiratory compromise. Faster care allows EMS providers to focus on assessments and interventions rather than unnecessary procedures. SMR supports evidence-based care, improving the patient's journey from the scene to the hospital. Selective spinal immobilization is applied when specific criteria indicate a potential spinal injury. Here's how to implement it effectively. 1. Patient assessment. Examine for pain, neurological deficits, or high-risk mechanisms of injury like falls or vehicle collisions. 2. Use of cervical collar. Apply a rigid cervical collar when spinal injury is suspected. Ensure proper fit to stabilize the neck without causing discomfort. 3. Positioning. Place the patient supine or slightly elevated if necessary for respiratory comfort. Always maintain spinal alignment. 4. Securing to the stretcher. Use stretcher straps across the chest, pelvis, and legs to minimize movement. Snug but not restrictive straps are key. 5. Communication. Instruct the patient to remain as still as possible during transport. Regularly reassure them to reduce anxiety. Selective spinal immobilization allows providers to balance spinal protection with patient comfort and clinical efficiency. Transporting a patient under spinal motion restriction involves proper securing. Ensure the patient is snugly strapped to the stretcher to limit movement. Effective communication. Encourage the patient to remain still while providing reassurance. Continued assessment. Monitor for changes in the patient's condition and adjust interventions if needed. This approach minimizes risks while ensuring the patient's safety and dignity during transport. Selective spinal immobilization and spinal motion restriction reflect the evolution of EMS care, prioritizing evidence-based techniques for better outcomes.